We have not seen anything like this. We've dealt with alcohol addiction since alcohol was introduced to us. This is that times 1,000 times.
As the drug crisis sweeps the country, one of the groups hit the hardest is Native Americans. And the Sault Ste. Marie tribe of Chippewa Indians is no exception. Of tribe chairperson Aaron Payment's 16 siblings, almost all have battled addiction.
I have a sister right now that's in jail. She's been in jail, she's in her early 40s. She's been in jail 70% of her adult life because of her addiction. And then my other brother's living on the street right now. And my brother died in January. And so it goes.
The Native American community has historically battled addiction, and they say it's not only still a problem, but it's worse. The deck has seemed to be stacked against them as experts discuss whether the problem is more genetic or environmental. But what it seems to come down to for many Native Americans, those directly affected, is the historical trauma of being forced out of their culture and identity and a broken promise. Many aspects of Native American religions were banned until 1978 when the American Indian Religious Freedom Act was passed.
One of the root causes of suffering for our people is that we didn't have the ability to know or engage in our culture and our ceremonies that we had historically, lived on.
The Centers for Disease Control say fatal drug overdoses in the Native American community saw a 500% increase between 1999 and 2015. Cosley says when she was younger, alcohol was the community's main addiction.
I was impacted with addiction problems at a young age. I was removed from the home. My parents were young parents with alcoholism.
But the substance of choice has evolved, and it's deadlier.
Now, moving forward to today, the opiate addiction, it just kills people.
The physician practices coupled with the pharmaceuticals preying on that have promoted the use of drugs, prescription drugs.
Payment largely blames the overprescribing and rise of opioids into the community on the pharmaceutical companies. And to fight back, he says they have joined a growing list of tribes exploring filing suit against the opioid manufacturers. But the tribes still face an uphill battle in overcoming the crisis.
It's not surprising to me that there's an overuse of painkillers on Indian reservations, because I think the quality of medical care that's offered is so far below what is necessary and needed.
Health services are provided for all members of federally recognized tribes through a government agreement. It's not a handout, but a promise given to Native Americans. And it's one they haven't forgotten.
So we don't receive what we receive because of reparations. We receive the funding we get and judicial precedence because of the treaties. And the treaties were signed consistent with the United States Constitution. So they're legal tender. However, the federal government is fulfilling that obligation, but they're only scratching the surface.
The Sioux tribe has 4 health centers serving 16,000 tribal members. But the tribe's health director says the funding they receive is only about 40% of what's needed. But the underfunding experienced locally by the Sioux represents a national and systemic problem throughout Indian country. In 1928, a report found a lack of funding and inadequate health care for Native Americans, whose health was designated as bad. Since then, report after report has been published by different groups and agencies, usually finding the same major problems, but also issues in policies, or the lack thereof, when it comes to opioid prescribing and pain management.
The Indian Health Service seems impervious to improvement.
Basically, the problems a century ago are still problems today. But the Native American community has hope that things could change. And Congress has also appropriated over $50 million to specifically address the crisis for Native Americans. And Payment says more is expected in the next budget, though so far it's not enough. In the meantime, the Sioux tribe is going to do what they can to fight the epidemic on their own.
If we're going to heal people, we can't wait for federal dollars for treatment services. So we're in the planning stages of building our own treatment facility. The solutions to our challenges is to bring our culture back and to pray for that direction and to listen to our ancestors and to fulfill our duty and responsibility for our future generations.